Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Michelle Bowman Carter and I'm joined today by our Regional Medical Director of Care Transformation for Baltimore City and Emergency Medicine Room Physician, Dr. Lucas Carlson, and also Angela Robertson, Population Health Dietitian and lead for our Food RX program at MedStar Health. Today we're going to be talking about care transformation and food as medicine, what these programs are, how chronic conditions such as diabetes can be better managed by following a specific diet, and where this help can be found. So if you or a loved one has a chronic condition and needs help to better manage it and get healthier, stick around, share this broadcast with your friends, give us a like to let us know that you're here, and share your questions with us in the comments below. We're going to take some time to answer those. All right, so at this time, I'd like to turn to Dr. Carlson. Thank you so much for joining us today and welcome. Before we begin our discussion, will you tell our viewers a little bit about yourself and share what care transformation is?
Yeah, thank you very much for having us here today, Michelle. My name is Lucas Carlson. I'm the Medical Director for Care Transformation here for our Baltimore City hospitals for MedStar Health, and I also work as an emergency room physician, like you mentioned. Care transformation is really part of a national movement to improve the way that we deliver care to our patients. Historically, medicine, healthcare has really been about the medications that we provide, the prescriptions that we order, the procedures that we perform. And what we've found over the years is that to really address someone's health, you have to address the conditions that underlie it. Those are often social needs that are unmet, access to care, issues with health education. And so with our Department of Care Transformation, that's what we aim to do, to bridge the gaps in the healthcare system and to connect our patients with the resources that they need.
That's awesome. Thank you so much, Dr. Carlson. Could you also elaborate, talk about food disparities in our country and especially in Baltimore City?
Yes, COVID-19 has really shown a spotlight on food disparities and disparities in general in our country, but especially in Baltimore. Even pre-pandemic, 1 in 5 residents in Baltimore City identified as food insecure. This means that 1 in 5 people weren't sure if they would have enough food for their next meal, or weren't sure that they would have enough food to put on their table for themselves and their family for dinner that night. Since the pandemic, the situation's only worsened. Food pantries have closed, soup kitchens have closed, financial situations are worsened. Access to care and the services that individuals relied on pre-pandemic have even been further obstructed by the barriers created by the pandemic. And ultimately, this has a real impact on patients and their health. As we'll be discussing here today, food is a key component of one's health. And even beyond hunger, food insecurity has major implications for their ability to manage chronic conditions like diabetes or heart failure or hypertension. And so it even exacerbate the disparities that already exist within our society.
Thank you for sharing that and explaining how things have progressed over the pandemic. Where did the concept for the Food RX program or Food as Medicine program come from?
Yeah. So the idea for Food as Medicine, or the Food RX, really grew out of the idea of the Collaborative Care Program. And the Collaborative Care Program is an interdisciplinary clinic that is based at MedStar Good Samaritan Hospital that was founded by Dr. Dana Frank. And the idea behind the Collaborative Care Program was that to really treat a patient, you had to treat the whole patient. That you couldn't just treat their diabetes and send them out, or treat their heart failure and send them out. That you really need to bring everything together and provide it in a more organized, coordinated fashion. So the way that healthcare currently works is that a patient will go to their cardiologist one day and get a care plan. And then a week later, they'll go to their pulmonologist and get another care plan. And then 2 weeks later, they'll go to their primary care provider and get another care plan. What they do with the collaborative care program is the patient sees the provider, and then they bring the specialist to them as needed to create that sort of integrated care plan for the patient. So they hear one message about how to manage their health conditions. And alongside this, they don't just manage the health component or the healthcare component, they manage the social needs that also accompany these health needs. So this would be things like food insecurity, housing insecurity, substance use disorder. And so within the collaborative care program, they have embedded a community health worker as well as a social worker, and then obviously our population health dietitian, Angela Roberson, is on the call with us today. And so one of the key needs that we found when we were developing this model was that food insecurity. We weren't sure how to approach that. And so we looked to the literature. And what we used was an evidence-based model that was developed at Geisinger Health. And we took their model and modified it to fit our local setting here in Baltimore City. And through this, we provide 10 healthy meals per week to a patient and their family. And these meals are medically tailored or tailored specifically to their medical needs. And the idea is really to take the social determinants of health paradigm and kind of flip it on its head. Instead of addressing the social determinants as a kind of adjunct or supplement to providing medical care, we are addressing that as a way to care for their medical conditions, really food as medicine. And I know that we'll be talking a little bit more about the success that we've seen.
I think that's awesome. I like that there's a team approach, that you address the holistic patient's needs, like from a holistic perspective. So thank you very much for explaining that. It sounds like a really good program too. So I think that's a great segue to speak to Angela, our lead for the Food RX program. So Angela, thank you so much for joining us. Could you please explain what a population health dietitian specifically does?
Oh. Angela, I believe you're muted.
I think you're on mute.
Yep. Gotta do that at least once. So again, thank you, Mashan, for having us on for us to talk about this. So a population health dietitian, you can probably also refer to us as community health dietitians or public health dietitians. And so I specialize in teaching positive nutritional habits to improve dietary choices or your dietary options. So generally, this education is centered around some medical condition or some disease. And the health concern or disease normally has a lifestyle component where food is also one of those components. And so dietitians that work in population health, as Luke was just speaking about, we factor in the whole person, so it's a little different from let's say, an inpatient hospital dietitian. Most community health dietitians work outpatient, and we service the surrounding community. So we factor in not just their clinical condition, but their social, their environmental situation as well. Do they have access to healthy foods? Is this person receiving SNAP benefits or WIC benefits? In which case, that dietitian needs to know what's approved on a WIC program. What foods can that mother get for herself and her baby, or what foods are allowed to be shopped in a grocery store if you're on SNAP. So I don't want to recommend something that isn't covered by these federal programs. And so that's really what a community dietitian does. It sort of meets that person in their environment and says, let's try to figure out a way for you to make healthier dietary choices based on your circumstances.
Excellent. Thank you so much, Angela. I think that brings up a good point with addressing people's health conditions. You need to know, like, do they have transportation? Do they have these resources in order to, like, after that appointment is done at the doctor's office, can they now take those steps and those tips from your doctor, from your dietitian, and continue and live a healthier life? So I really like this approach. And I think that's really good to hear about this program and the accessibility that it brings to our patients. At this time, I'd like to pause and welcome our viewers. Thank you so much again for joining us today. We are talking all about care transformation and how food can be used as medicine to help patients manage chronic illnesses such as diabetes and congestive heart failure. I'm here with our Regional Medical Director of Care Transformation for Baltimore City, an emergency room physician, Dr. Lucas Carlson, and Angela Roberson, population health dietitian and lead for our Food RX or Food as Medicine program at MedStar Health. We have much more to talk about, so keep watching, share this broadcast with your friends, give us a like to let us know that you're here and tuning in, and share your questions with us in the comments. We're going to take some time to answer those. And speaking of questions, I have one in particular from one of our audience members named Andrea. She's asking, what are the best foods to prevent inflammation?
so I'll take that one. Yeah, so there are a lot of, inflammation is generally a sign, that something is going on in the body, something haywire is happening, and the body's natural response is inflammation, right? To sort of combat whatever is happening. So we like to encourage people to eat a plant-forward diet, right? Eating more fruits and vegetables. Antioxidants are very helpful, and you can get those in anything that's in the red, orange, yellow family, right? So vitamin C, vitamin A, and vitamin E are antioxidants, and anything that's orange, yellow, or red have lots of vitamin A or beta carotenes. So you want to start there, and then anything that's really rich, like dark in color. So blueberries, anthocyanins, strawberries, raspberries, these things, even dark green leafy vegetables like broccoli or spinach, have a lot of antioxidant properties. The only caveat I would add is that if you are currently on a blood thinner, you want to consult with your physician before you start, really throwing in a lot of dark green vegetables.
All right, thank you, Angela, for sharing that response, and thank you to sharing your question with us. I have a few more questions for you, Angela. So why do food and meal planning play such an important role in improving health for patients with chronic illnesses?
Yeah, so, I kind of say everything really starts with food and with your diet. If your diet's not the best, it's really hard to be healthy when you're not putting healthy things in your body. So things like heart disease, coronary artery disease, often these patients have what we call hyperlipidemia or high cholesterol, high triglycerides. We know that that is a problem for the blood vessels, right, for the arteries. Patients who have diabetes, we know that eating a high carbohydrate diet is problematic. However, the body runs on carbohydrates, so we cannot eliminate them altogether, but we do need to learn how to manage them so that when we incorporate them into the meals, that we do so in a manner that the body can accommodate and that is in correlation to maybe the medication that they're on, right? So diabetes is really a balancing act between whatever medication the patient may be on, but also managing with food and physical activity. You really need all three pieces to really, what I call put the fire out. A lot of our patients, when they come see us, they're hyperglycemic, their blood sugars are sky high, and they're feeling the effects of that high blood sugar. And so when they come in to see us at the CCP, we really need to get those numbers down kind of any way we can. And then we start building on the education, the layering, so that folks understand that you can eat all the foods that you're comfortable eating, that you were eating before. You can continue to eat them. You just can't eat them in the same volume.
That's good to know, because I do like to snack. So
there's always a way.
Just add more veggies to the plate. So
more plant forward. You want to, if you can, replace some of the saturated fat meats that you eat with more healthy fats and oils like omega-3s, right? Omega-6. Try to eliminate some of the carbohydrates and replace, and that will have an effect on that lousy LDL cholesterol. So food definitely does work as medicine in conjunction with just trying to overall live a healthier lifestyle.
Thank you. Thank you very much for that.
Yeah.
Could you also tell us about the specifics of the Food RX program and how food is prescribed?
Sure. To go back to what Dr. Carlson was saying earlier about how we had to sort of step back and take a different look. We had to take a different approach to how we were administering healthcare. And, I always come to mind, the late Desmond Tutu has a quote that always comes to my mind when he says that we must stop just pulling people out of the river, that you have to go upstream to find out why they're falling in, right? And so CCP and Food RX is going upriver. We're going upstream to find out why patients are falling in, right? We've been pulling them out for years and years and years, but we haven't really addressed why they're falling in. And so when patients come to the CCP, they're assessed by a full medical team, including myself, and as well as a social work team, our community health advocate, social worker, to find out, what does this patient need? Why is this patient not successfully managing their disease, whatever that disease may be? It may even be just weight. Maybe it's a weight issue and they just can't seem to manage it. So let's figure out what's going on in their life, and let's try to build on that, because you can't change a person's entire life. You have to work with what's going on with them at the time. So they're screened through the CCP. If they meet the criteria, often an A1C greater than 8, some level of food insecurity, COPD or CHF, coronary artery disease, they are then admitted into the Food RX program. It's a 6-month program. We provide one-on-one nutrition consults. They're seen by me twice a month at a minimum, sometimes more often. They receive food from our pantry. So we have non-perishables as well as fresh lean proteins like fish and chicken breasts and ground turkey, those sorts of things. We know that fish is important for the omega-3s, the omega-6s. There's EPA and DHA. There are all these properties that food has that are very medicine-like, when you can incorporate them in a daily basis. So we provide 10 nutritious meals a week, what we say are medically tailored. So every person is individual. There's no one treatment plan for everybody. Everyone is assessed based on what that person needs, what that person likes. And then we prescribe what we call medical nutrition therapy, these medically tailored meals, as we teach them how to just eat better.
All right, thank you so much for that, Angela. After the food is prescribed, where does that food come from?
So we have really, really wonderful partners in Food RX. The Maryland Food Bank provides our non-perishables. We have Sodexo, whose logo or motto is quality of life services, and they provide our frozen proteins. We also have a company by the name of Hungry Harvest. Our patients are delivered to their homes either weekly or bi-weekly. They receive a delivery of fresh fruit and vegetables, which is really powerful for people who are on a fixed income. Food prices are going up every day, and fresh fruits and vegetables can be hard to afford for some if you're not shopping seasonally. I'm really excited that the weather is warming up and farmers markets are now about to start happening. So everybody get ready to get out on the weekend or on that Thursday morning when those farmers markets are open, because that's where that fresh grown, full of its nutrients and antioxidants, that's where that food is. That's the food you want. So I'm really excited. But yeah, Hungry Harvest, Sodexo, the Maryland Food Bank. And then we also have some non-food partners like the Y of Central Maryland. And more. If you'd like to be a partner, please, we would welcome it.
No, I just want to add to that this program is really built on a foundation of partnerships. As Angela just listed, there's so many other organizations that are involved and that have been supporting this initiative. And I also just want to recognize Maryland Community Health Resource Commission, as well as Aegon Transamerica Foundation, who have helped to fund this program as well. And just really appreciate everyone coming out to really build this initiative from the ground up.
Awesome, very awesome to hear. And thank you again to our partners for helping us make this program a success. It really is good to hear. So along the lines of we hear about the food that's prescribed and where it's coming from, but how much food do the patients get? And is it just for themselves, or can they, make meals for their family?
So it is for the household, right? It's important that everyone in the household sort of learn a healthier way. And so if there's a household of 2 or 4 or 6 or, infants in the house, oftentimes grandparents or caregivers these days. So it is for enough food for the entire family. And again, it's 10 meals. So they receive enough food to make 10 medically nutritious, healthy meals a week. And they're seen every 2 weeks. So twice a month, they can come in and get 2 weeks worth of food.
I like that. I like that. And what do you consider to be some of the most impactful components of the Food RX program from a patient's perspective?
Again, I think it all goes back to the teaching, the nutrition. There's so much confusing language and rhetoric and promises and the magic pill out there, and people are really confused. I think the thing I find most often is newly diagnosed diabetics or long diagnosed diabetics that just have never had a conversation with a dietitian ever about managing self-management and using food as medicine. And I think that has been the most significant. You can sort of see that aha light bulb go off as you're talking to them, where they sort of start putting together the pieces of what's been happening to them and how they feel with the medical reasons of why these things are happening. And you see them say, oh, that's why, this has been going on or that's been going on. And so as people start to learn more and understand more about the disease or the disorder, they can more fully engage in the conversation and then the choices, making these healthier dietary choices. They say, oh, I see the benefit and I see the logic behind it now. And before they were just blindly doing what they thought was best. And oftentimes it wasn't.
Thanks, Angela. I think that's a good segue. We have an audience question that I'd like to share with you both, and feel free to chime in, Dr. Carlson. This one is from Karen. It's talking about what is a good diet for people on medication for high blood pressure and high cholesterol. I know that the Food RX program is tailored to people with, chronic conditions, congestive heart failure, diabetes, things like that. But can you speak to the fact that the program, we're not trying to endorse a specific type of diet, we're just trying to educate people and provide them with the healthy, nutritious foods that will help them.
Yeah, I'll let Angela talk a little bit more about the specifics of what sort of healthy foods to take. But the one point that I will make is that many health conditions beyond just diabetes, which is the first one that typically comes to mind, are food sensitive conditions. Hypertension, hyperlipidemia are highly dependent on what a patient eats every day and how and what their meals are. And so I think that even in those sorts of conditions, it's important to think about what foods you're taking, and also programs like Food RX might be appropriate for you as well. Angela, I don't know if you want to say more about the specific foods to avoid or take for those conditions.
No, other than there's a heart healthy diet, right? That we all know. Lower salt, less saturated fat, more physical activity. Get more sleep, try to eliminate stress. These things all go a very long way in mitigating heart disease.
And as any primary care provider will tell you, that once you get that initial diagnosis, sometimes it's possible just to change your diet and come off the medications that you might have initially been started on, and truly manage your health condition with food.
That's great. Thank you both for your help with that response. And thank you, Karen, for sharing your question with us. At this time, I want to turn back to Dr. Carlson and talk more about the Food RX program. Who exactly is eligible to be a part of the program?
So all patients that come through the collaborative care program are screened for food insecurity. Our community health advocate meets with each of them and does a social needs screening, and food insecurity screening is included in that. And so after a patient screens positive for food insecurity, they're referred to Angela, and Angela meets with them and talks with them and provides education, and then also assesses whether they would be appropriate for the Food RX program based on their medical needs, their individual needs, underlying health conditions. Typically, our target population is diabetes, uncontrolled diabetes with HbA1c greater than 8. HbA1c is the measure of how well controlled someone's diabetes is. But as I said, there's many conditions that are food sensitive. As Angela determines based on those different conditions, whether or not they'd be appropriate for the program. Angela, I don't know if you have anything else to add to that.
No, those are pretty much the criteria. And a lot of times it's if I think that there is something that I can add, right? So sometimes the patient may fall a little bit out of the parameters of the criteria. But if I think that there's something there that I can work with that will help them, maybe it's just receiving the fruits and vegetables on a weekly basis. Maybe it's participation in our virtual cooking classes. Maybe I think this person would benefit from, more physical activity, and I want to sign them up for the Y program. Something that I believe will improve the quality of their life, right? And if I just give them an opportunity, and if they take that opportunity, then that's a win for us.
Thank you guys again for responding to that question. Dr. Carlson, continuing on, what benefits have you seen so far from the FoodRx program?
Yeah, this is the really exciting part, is that the program's less than a year old, and we've already started to see really remarkable results in terms of impact on patients' health. One of the things that we look at is HbA1c, which I mentioned before, is a measure of how well controlled someone's diabetes is. Just to give some context, if a new medication that's coming to market for diabetes, what they typically look for is an A1C reduction of about 1 point over the course of a year. So far, for patients that have been enrolled in the program for at least 3 months, we're seeing on average a 2-point reduction in HbA1c, which is tremendous. Some of the other things that we're looking at are reductions in ED utilization, inpatient hospitalizations, total cost of care. We'll need some more time with the program to continue to evaluate those measures, but based on anecdotal experience, I have no doubt that we'll see a significant impact there as well. And the other benefits that we've seen are really at the patient level, just hearing the stories of people who were on insulin before they were able to come off of insulin, people who just never realized what they could do with managing their diet. And those stories just are very rewarding, but also just show the benefits of the program.
That's really awesome to hear about the progress being made and the help that you guys provide through the FoodRx program. That's really good to hear, and should be a good sign to our audience that this program is efficient and it's working and it's helpful. So I think that's a great segue to our audience questions. We have a few here. So I'll share one from Laureen, who's asking, is there a way to get omega-3 and 6 without eating fish?
So you can get omega-6 in other places. Omega-6 primarily you're going to get from plant sterols, right? Plant esters. So safflower oil, canola oil, avocado oil, these are where you'll find your omega-6. And we actually, in our diet, we get plenty of omega-6. The one that we tend to get shortfall of is omega-3, and that one is very fish specific. I think, things like walnuts, nuts in general, nuts and seeds, you can get omega-3s. But yeah, those fatty fish, the salmon, the mackerel, that is where you're going to get the largest amount of omega-3s.
Thank you very much. Oh, go ahead.
One of the things I wanted to mention too, just sort of tail off of what Dr. Carlson said is, a lot of these lifestyle diseases have a really high burden on our medical system, on our health insurance, our medical care, our emergency rooms. Diabetes, has a tremendous burden on our health insurance and our healthcare system in the billions. This medication that our patients ultimately need to be on in the beginning, but may be able to wean off of, is not cheap. Insulin and other oral therapies to treat diabetes are very expensive. And so here in the clinic, while we obviously want to go for the gold standard of medications at all times, sometimes the insurance just doesn't cover it. And so we, our PA here makes sure that when she prescribes and when we write a script and send something to a pharmacy, we make sure that that patient's covered, that medication is going to be approved, whether it's a continuous glucose monitor, whether it's a CGM to monitor their blood sugar. We make sure that's going to be approved. $200 is a lot of money for someone to go and pick up all of these tools, these new tools now that make managing diabetes a lot easier. But when you think about the amount of money that this program spends versus the amount of money that the healthcare system spends on trying to not manage the disease, just treat it, it's really a worthwhile. It's really something worthwhile to take a look at, long term.
Yeah, Angela, I'm really glad you mentioned that. Part of the idea here is that this is really a proof of concept, that we're showing that you can use food as medicine to treat patients with diabetes. The goal of that, in part, is that if we are able to demonstrate that there's a significant effect, that we'll be able to go back to insurance companies and have this reimbursed long-term sustainability of this program and expansion across the Baltimore area, the region, the nation. Right now, we're offering this program free of charge, and it's thanks to our donors and thanks to our sponsors and program partners. But for the ultimate sustainability, finding a way to demonstrate to the insurance companies that this is effective, I think will have a real impact and make it last for the long term.
Agreed.
Absolutely. Thank you both for responding to that question, and thank you, Lorraine, for sharing that with us. I have another question from Andrea, and this is also related to diet. She's asking, is there a quantifiable guideline for max grams of sugar per day? So, Angela, I'll direct that to you.
If there is, I don't know what it is. No. And I guess I would want to know the context in which she's asking the question. Is there a larger issue or is this, just kind of how much sugar can I eat a day, or is there, something else going on? So I'm sorry, that's not a question I can answer without a little bit more context.
No worries. Andrea, thanks again for sharing that. And maybe we can discuss more in the comments after the broadcast, but thank you again for sharing that with us. So at this time, I'd like to turn it back to Dr. Carlson. Are there any plans to expand the Food RX program?
Yes. So building off of the early success that we've already seen at MedStar Good Samaritan, we are planning this summer to expand the program to MedStar Harbor Hospital, where we will be embedding another Food RX program within the endocrinology outpatient clinic there. We have support. They're very thankful to Spelman Foundation for their support, as well as we'll be partnering with the Baltimore City Department of Planning and Food Policy for this expansion. We're also starting to explore opportunities to expand out to MedStar Franklin Square Medical Center in Baltimore County, and so that would be the next foray after that. But ideally, this program would be available across the entire region.
That's really good to hear. Really good to hear. So be on the lookout if you're in that community near MedStar Harbor, near MedStar Franklin. Keep an eye out for this program. It could really help. So my last question for the both of you is there anything else that either of you would like to add about the Food RX program, food as medicine in general, anything like that? So I'll start with Dr. Carlson.
The one thing, just because I know that she won't say it herself, is I just want to recognize Angela Roberson and the work that she's done in this program and bringing it to the success that it's been. This program has taken a tremendous amount of dedication, time, effort, and Angela, you've done a phenomenal job, along with the rest of the team, Nicole, Preeti, Davon Carter, who's the community health advocate, works in the program. I just want to, it takes a team to create something like this, and I just want to recognize them because you've all done an amazing job.
Thanks, Lou. I appreciate that. I think what I would say is that I look forward to expanding this to other facilities. I think it's something that's much needed in our community. I was looking at some statistics, and the Maryland Department of Health has listed Baltimore diabetes as the 6th leading cause of death in Maryland, Baltimore City. Amputations, 50% of all amputations that are diabetes related could have been prevented with earlier intervention and education and nutrition, diet education, medical nutrition therapy. And so what I'd like to say is that I'm hopeful that as this program expands, that we can get there quicker. We can get to our patients sooner. And we can let them know that, you can live a really, really good life with all of these diagnoses. And, it's no one's fault. It's nothing that they did, but treating the whole person is the answer to keeping folks out of the emergency room on a regular basis. And so I'm just excited to see this program expand to different facilities.
Perfect answers. I thank you guys for sharing your responses. I'm excited about the possibilities and the future of the FoodRx program. I'm thankful for you guys spending the time with us to share all of the wonderful work that you're doing in helping our patients. And that wraps up our broadcast. Thanks again to Dr. Carlson and Angela for joining us today and sharing information about this important program. Many thanks to all of you, our viewers out there, for tuning in and sharing your questions with us. If you're interested in learning more about the FoodRx program, or if you'd like to request an appointment, please call 443-444-5463. We're going to share that phone number in the comments as well for you. So be on the lookout for that. Thanks again for tuning in and watching, and have a great day. Bye.
Thank you, Sean. Thank you, everyone.